Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board-Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about if your medication is affecting your mobility. This is a topic that doctors often don't bring up until maybe it's too late. So we wanted to draw your attention to how certain medications can affect your movement and your overall health. And if you are starting to notice any weird symptoms in your mobility, that maybe you consider what we're about to talk about today. So one thing that we know, and there's been research to prove, that if you are on more than 3 medications, any 3 medications, you are at a higher risk of falls. And that's because there are all different small little interactions that can happen between medications that can present differently in people. So just being aware that that alone is a risk factor. We never want you to be on more medications than you absolutely need to be. Again, big disclaimer here, I am not a medical doctor and I'm also not a pharmacist, but I want to make sure that you guys have as much information as you need to be able to go back to those providers if you have questions. So it's important to understand the risks so that you know what you can do to help mitigate them. Over time, some of the medications you're on might lead to neuropathy or numbness and tingling. But what we have to consider is that these medications might be needed for other more significant medical problems. So we have to say, hey, if I need it for this, then I have to figure out how to manage the fact that maybe I can't feel my feet as well, and that is affecting my balance. Now, how would physical therapy help with something like that? Well, the balance system actually has 3 components, one of which is the nerve endings in our feet and our joints that tell us where we are in space, and that's called proprioception. That is the one that can be affected due to this type of neuropathy. The other 2 main systems that help with balance are our vision and our inner ears. So in physical therapy, we can work on different balance activities that can strengthen those other 2 systems if the neuropathy, for example, in your feet might be limiting one of the systems that contributes. Another thing to consider when it comes to medications is we do know that some antibiotics can lead to an increased risk of tendon tears. Again, I'm not going to give you all the specific names of everything, but being aware of the quinolone family. So the most common ones that you might hear of are Cipro or levofloxacin. Again, not a pharmacist, and I can't tell you if there's any alternatives that you might be able to take instead of those, depending on what's going on in your particular case. But if you are prescribed those medications, you can ask your doctor if there is an alternative. I know that one of those medications is often recommended for patients. It's an antibiotic, so for pneumonias and things like that, which again, lesser of the evils, but we have to know that if you do start to notice any tendon type pains, that is a precaution that you might be being affected by that class of medications. Also, blood pressure medications. Again, we have to control our blood pressure in some situations, but blood pressure medications are usually given to people to lower their blood pressure. You also then might be told to improve your diet and other things that can help control your blood pressure. So making sure that you're regularly checking in with your doctor to see if you still need those blood pressure medications, because if you are maybe decreasing your salt intake and your blood pressure is coming down, but you're still on a decreasing blood pressure medication, you might actually have symptoms of lightheadedness or dizziness, and that's because your blood pressure might be getting too low. So again, just things to consider if all of a sudden you're noticing these symptoms and a possible change in your mobility or ability to function in life, that it could be tied to your medications, and that you follow up with your doctor. Okay, if you have any other questions, please reach out today, Bay Area Physical Therapy. For a little bit more information, please visit our other blogs on reducing the risk of falls and treating vertigo with physical therapy. Thank you.